Hi, this is Mario with Health and Wellness. This is week number 5, journal number 5. This week's journal has to do with diabetes assessment, and it was regarding type 2 diabetes. And the first question was, explain the results of your assessment and identify your risks of diabetes. Well, I took my assessment, and as you can see, there's a lot of no's and there's just 2 yeses. And out of the 2 yeses, the first one I answered was, is there a history of diabetes in my family? And that was a yes. My grandfather on my mother's side had diabetes, but as a kid, I used to think he was diabetic from a child. But then more recently, I found out that my mother explained to me that he was type 2 diabetic. So he started shooting insulin later in his life, which was obviously a nutrition problem with him on diet-wise. He wasn't overweight, my grandfather, but he did eat a lot of pasta, a lot of high glycemic food. So, and he had a bit bad sugar tooth. My grandfather, with his coffee, would put, at that time, it was sweet and low he was using, and tons of it. And he ended up dying of cancer, my grandfather, at 72 years old, something like that, 71. Then my second question that I answered yes to was, do I urinate frequently? Well, I do urinate because I drink water all day long. So it's not because I'm diabetic. It's because I drink a lot of water. And that's just the negative on drinking too much water each day. I at least drink about almost a gallon of water a day because your body needs water. It's made up of 70% of water. And as a child, we're actually made up of more percent of water. The second question, let me see. That's it. That was my 2. Now, explain the relationship between health wellness and by discussing the impact of diabetes mellitus on at least 3 dimensions of wellness. Well, I took the time to answer 4. And the relationship between health and wellness with 4 dimensions. The first one I chose was the physical dimension of wellness has complete control of manifesting type 2 diabetes. As stated in our book, physical health is an investment in positive lifestyle habits. Our genetics really have nothing to do with whether we get disease or not. It is our lifestyle choices in food, nutrients, and habits that turn on those gene switches to engage diabetes in the body. So in a recent study a recent statement from the Human Genome Project, they said all the work they did on the human genome, that genes have nothing to do with whether we're going to get our illness. It's what we do to turn those switches on that's the cause. So the physical dimension of wellness, we have our own control. We could change those gene switches on or off. We could turn them on or off. So next one I wrote about was spirituality. Spirituality can also play a role in maintaining a life free of diabetes by reducing stress in one's life. Usually when we're all stressed out, stress will usually cause overeating of the wrong foods and weight gain that will lead to getting diabetes. So remaining spiritually strong would only benefit the person's overall health. I know if I'm stressed out or if I'm bored, I should say, sometimes you go reach for the wrong foods because you just want to eat something to fill some kind of void. So if we're more spiritually stronger, we could easily avoid that and make better choices. The next dimension of wellness was the environmental. Environmentally, wellness has a lot to do with whether someone gets diabetes in their life or not. Living in a poor neighborhood where food choices are limited is one of the biggest factors of why minorities have diabetes and obesity problems. There are too many fast food restaurants in these neighborhoods and not a lot of big supermarkets in these areas that offer better quality food. They mainly have bodegas and small convenience stores that have all processed foods, soda, and junk food being sold in them without any fresh vegetables or fruits and unprocessed meats and chicken. those are things that our environment have to do. I would say environment and social kind of work together in that, because our environment, of where we live, and our social, um, it's kind of like together on that one. Intellectually is another factor that could be responsible for having, better health, and help eliminate diabetes. If you were intellectually, if we're Intellectual wellness is also essential in being knowledgeable of food, diet, and nutrition. So the more people know and understand how to take care of themselves naturally, the less doctor intervention there will be, and the lower health insurance there would be. So if we eliminated going to the doctor all the time for every little thing, because of our diets are so poor, and the type of food that we're putting in our body is poor, and our habits are poor, we're going to constantly be going to the doctor. I personally do not go to the doctor at all. I don't have to, because I take care of myself. I'm never sick. I eat the proper foods, and I take care of my health with proper nutrition and holistic healing. The last question was, identify 3 lifestyle habits a person can practice to reduce his or her risk of type 2 diabetes. Well, I kind of did more than 3 because they kind of work hand in hand. So eating more vegetables, or organic meat, organic chicken, organic eggs, organic fruit, and less grains that have gluten in them. And also staying away from refined sugars would be an excellent benefit. First of all, first change. Second would be exercising 30 minutes a day, 5 times a week, would definitely reverse a lot of disease just on its own without changing the diet. But obviously, changing the diet would be crucial in having full benefit from the exercise. The last one would be, this is my combination, would be drinking plenty of water and taking a liquid multivitamin and multi-mineral complex. Like what I take is called Tangy Tangerine from Longevity, and that helps with all my ailments. I don't have any more osteoarthritis I used to have, because now my body has the proper raw materials it needs to heal itself. And also and this is also the extra combination, would be getting plenty of rest. With sleeping at night, you have to have a good sleep. I mean, a deep sleep where your body goes into healing. So when you don't get good sleep at night, that's when your body doesn't heal as well. And that's kind of one of my problems, is I never really get a full good sleep. I usually get maybe 3-4 hours solid the most, and I'm always up. Every once in a while I'll get up either when I first fall asleep, and then I'll wake up, maybe sleep 3 hours, then wake up again, and then I'll go back to sleep. But it's never solid like 6-7 hours. I never get. So that's I need to work on getting better sleep. But that is my journal for this week, the last week. It was a pleasure to be in your class, Professor. And hopefully maybe we'll have another class together. Thank you, and God bless.